First of all, I'd just like to introduce myself a little bit. I qualified in Sheffield in '93 as a doctor, and I've been a doctor for 20 years. Sounds strange hearing myself say that, but it's gone very quickly. And I've been a local GP for 10 years, and I'm also involved in training of other GPs. Up until 18 months ago, I've sort of been quietly observing reform after reform, and often I'd ask myself the question, how does this reform help me do my job better? How does this reform help the patient? And often the answer to both of those questions was, actually it doesn't. And I've gradually seen the creeping privatisation in one form or another. 18 months ago, I had an experience which made me change from being a passive observer of the wrecking of something I treasure into being active. And this event was a discussion with our local leader GP, head of our clinical commissioning group. I said to him, there's problems there's problems our patients being assessed properly in casualty, there's problems with patients being admitted because there's no room at the inn, there's no beds. And when they do get admitted, they're discharged prematurely. And I was quite shocked by the answer I gave. In the order of the questions, question number one, the answer was, you're too sensitive. Question number two was, well, I've just got a very unlucky group of patients because he's not heard this from any other doctor. And the final straw was, don't worry, you're not paying for it. So I had that same reaction, thank you very much. And it was from that day onwards I said, I've had enough. I've been waiting for 10 years for somebody else to do something, and I thought, well, hang on, why don't I do something? So I've been on a journey of rapid learning curve to try and find out what's behind all these changes, and the answers are quite frightening. The answers are none of what's going on is either aimed at helping patients or helping the professionals do their job. It's all about money. So these are the questions I ask myself. Was there a public demand for what's going on? Well, I'm not aware of any. Was there an electoral mandate? Is this ideology over evidence? One clue might be there's £100 billion for people to get their hands on. Is this corporate led? Or is it just basic greed from our good and great leaders? So on this quest I had a bit of help, and some of my group I set to this task, and I said, could you look into what interest our politicians might have in the privatisation of our health service? It might be quite instructive, it might help me understand what's going on here. And very kindly, Jerry has been very busy. I think he got a Blue Peter badge in his earlier days, and he's put this together for us.
Yeah, well, forgive me, folks, but I just thought I'd put together a short list. I think we're going to need some more hands on this. I thought I'd put together a short list of MPs and peers who have interests, financial interests, in the health service, or should we say in private health service. We're going to need some more hands here, mate. It's only a little list, honest. Can you move off that way a little bit with it? There's not a lot of them. It's so trustworthy. So?
So I hope you all agree, Jerry has done sterling work there.
These are the people we elect. These are Lords and MPs, and they've got private healthcare interests.
And I think one other observation that does need to be made is every man jack of these voted on the bill that is now privatising our National Health Service.
So you can see we need your help with all these people against us.
Right, thank you very much. There was over 200 people listed on that document, and these are people who voted through the health reforms. So, was there a political mandate? Well, all parties went out of their way to say, we all love the NHS, we won't touch the NHS. David Cameron was quoted as saying, there should be no further top-down reorganisation of the NHS. We see from this BBC headline that in 2010, the British Household Survey rated satisfaction in the NHS at a record high. So there was no public appetite for this disastrous change which we are seeing unfold before us. Within months of the election, he announced this massive top-down reorganisation. Strange, isn't it? In my book, that's a lie. Is there any evidence behind what is happening to our NHS? Well, actually there is none, because nobody's actually made an argument. It's all been about negative propaganda and feeding on people's prejudice and misinformation. And this has been very, very much assisted by our media, who have not bothered to scrutinise any of the announcements the government makes. It just basically repeats press releases. No scrutiny going on whatsoever. The problem is you need to know a bit about what's going on to understand you're not being told stuff. This is censorship by omission. They are just not telling you what's going on. For the amount of money we spend as a country on health, we do extremely well. Now the arrow is pointing to the USA. Now the USA is the model the government is copying. All the bad press you're hearing about the NHS, if you knew the facts, you might see them in a different light. So we spend less than half the US, and we do better than them. This graph makes a slightly different point. It looks at GDP, this is gross domestic product, i.e. the country's wealth, and what proportion do we spend on looking after ourselves? What proportion do we spend on health? Well, if you look right on the right-hand side here, you've got our American model trendsetters spending nearly 18% of their wealth on the health service, which is predominantly privately run. Whereas we come at a modest 9.4%. Yet everybody is telling us the NHS is unsustainable. Please explain. I don't understand. We spend less than most of our European cousins. We spend less than America. This does not look like an unsustainable graph to me. And if you look at the cost of surgery, these are two operations. In the orange, we see the cost of a bypass surgery. Let's look at the US. How much do they charge? $73,000 for a bypass surgery. How does inefficient NHS do? $14,000. Why are we copying the top people? Explain this to me. Nobody can explain it. So this is why nobody bothers talking to you about these figures, because it destroys their propaganda. The NHS was an international, held up as an international example of an efficient healthcare system. We raise funds by taxes. We don't have to have a separate insurance administration system. We used to spend 5%. Everybody was amazed. How did we spend 5% on admin? This has gone up to 15%. So of that £100 billion, £10 billion is pulled away from the patient into administration in preparation for the end game. The US, for every $3, $1 is spent in administration. And by administration, I include this lot. This is not a full list. Administrators, managers, accountants, lawyers, insurance companies, advertising agencies, highly paid executives, shareholders, don't forget the laws of the MPs. So what we are witnessing, what we're in the midst of, is setting up the NHS to fail. And there are many levers to do this. Top of the list is PFI, Private Finance Initiative, where you burden hospitals with expensive financing. There's a bit more detail in the pages we've left out with you. And this expensive financing burdens neighbouring hospitals, and we saw pressure on staff. So staff we've shed about 5,000 nurses. I can't tell you how many doctors have been lost. But you can only spend money once, and PFI takes precedence over staff. PFI gets paid first. At the same time, you want to erode staff morale, so you attack them in the press, and when the system fails, you blame the staff. She came along, she developed severe pain in her back, right in the centre of the spine, and we diagnosed a fracture of her spine. Unfortunately, within a week or two, she started to develop more serious symptoms. Weakness in the legs, shooting pain in the legs. Whenever she coughed, she developed shooting pains in the legs. She could hardly stand. Now, I hope most of you non-medical people would realise there's a problem here. Now, in my mind, this lady's spinal cord was in danger, and I sent her into hospital. She balanced in once, she balanced in twice, she balanced in for the third time. I have the letter that I sent her in with on the third occasion. In bold letters at the top, suspected spinal cord compression. In bold letters down the bottom, spinal cord compression must be excluded. On the second page, this patient should not be sent home without an MRI imaging of her spine to exclude spinal cord compression. My phone number, I gave this to the daughter. The daughter's in the audience here, so she can, there she is, just putting her hand up. Verify everything I'm saying. On the third occasion, I said, keep your mobile phone with me. If anybody attempts to send you home without scanning your back, please ring me. Guess what? They said, you've just lost confidence. It's a side effect of the drugs that your GP's put you on. Please go away. And then the doctor proceeded to run off. So kindly, this lady's daughter chased after him down the corridor and said, my GP wants to speak to you. Unfortunately, the language I used on the phone was not suitable for this venue, but he eventually agreed to scan her back. And then he sent her home, said the scan was normal. Now at this point I felt a bit guilty and maybe I'd overreacted. Unfortunately for the lady, within a day or two, she was paralysed. And she's still paralysed. They had failed to interpret the scan properly, they'd sent her home. She followed on a 5-month stay in hospital. She underwent an emergency operation on her back to fuse her back, but unfortunately this hadn't worked. To add insult to injury, it took another 3 months before anybody bothered to tell them they found cancer in her spine. Now it pains me to give you stories of NHS failure, but what I'm trying to point you, I don't want to condemn the service, that's the last thing I want to do. I'm trying to illustrate that the service is under intense pressure. I believe the doctors at the other end are under intense pressure, and this is where mistakes happen. If you're acting outside of your competence, if you're acting without supervision, if you're acting in a very busy environment, I challenge anybody to maintain their composure and concentration. This lady is paying an extremely heavy price for something I believe could have been preventable. And hopefully I've made the point clear that things are in danger now and people need to act. Thank you.